I was really surprised to receive the Commonwealth Health Minister's Award. It came as a real shock to me, and I was really privileged and humbled to receive it. I received a call from the NHMRC CEO, which in itself was a bit of a shock, and to then be notified of this award, I was truly humbled and surprised, and ultimately I was really pleased to see recognition that this area of research around infection prevention was recognised by peers as being really important. Ultimately, what I'm doing is preventing infections from occurring in the first place. And what that means is that people who get infections, particularly in hospital and healthcare settings, they're more likely to die, they're more likely to have serious complications in hospital if they get an infection. So my research is really aimed at preventing these infections from occurring in the first place. It helps, most importantly, patients. It also helps hospitals and health services reduce costs through reduction in diagnostics and treatment. And it also helps reduce the amount of antibiotics that are used because we don't have infections in the first place. And that ultimately helps us in terms of the prevention of resistance to bugs. So the next stages for my research are really to focus on the most common infections we have in hospital. So do you know there's 160,000 infections each year in Australian hospitals? And it has a big morbidity and mortality. Now, the most common infections in hospital are urinary tract infections and pneumonia, and that's where my research is really going to focus on trying to prevent those from occurring, and those types of infections in settings outside of hospitals as well. And the other thing I'm really looking to do in the future is work with industry. It's something I've been doing for a number of years and something I really want to strengthen, where we have patients, industry, researchers, and clinicians working together to find solutions to these problems like prevention of infection. And that's what I'm focused on, and that's where my research is going to head in the future years as well.